and welcome to yet another episode of Dr. Zen. This is me, Naina, with you. Today we have with us Dr. Vigil Rosemary Peter, who's a gynecologist. It's my pleasure to welcome her to the program. Welcome, Doctor. First of all, we would like to know more about you.
I'm Dr. Vigil Rosemary Peter, and I'm working as a specialist obstetrician and gynecologist at International Modern Hospital, Dubai. I came to Dubai 2 years back, and before that I was working in Cochin in Kerala in India. I have done my studies from India, and I have more than 11 years of experience in obstetrics and gynecology.
Okay. So now could you just tell us about the various kinds of gynecological cancers?
Yeah, by gynecological cancers, or cancers specific to women, we mean cancers of the female reproductive tract. So as we know, the female reproductive tract consists of the uterus with the cervix, that is the mouth of the uterus, and the ovaries, which produce the eggs, and the fallopian tubes, which bring the eggs after they are fertilized to the uterus. Apart from that, we have the vagina, or the birth passage through which the baby passes during delivery, and the external genital structures, which is called the vulva. And breasts are also included under this female reproductive system. So we will also be looking at the screening and early detection of breast cancers. So we have breast cancer, uterine cancer, cervical cancer, ovarian cancer, fallopian tube cancer, vaginal cancer, vulval cancer, and then there are some rare types of cancer. For example, rarely fibroids can turn into cancers, but those are the rarer types. The most common ones are uterine cancer, ovarian cancer, cervical cancer, and breast cancer.
For which cancers are screening tests available?
Before we go on to the screening, let's just look at the most common types. In the developing countries, cervical cancer is very common, whereas in the developed countries, breast cancer is more common, and this is because they have effective screening techniques, and so the cancer cervixes are detected in the early stage and treated. So now the predominant cancer in the developed countries is breast cancer. So first of all, let's look at what we mean by a screening test. A screening test is a test that we do in healthy people who don't have any signs or symptoms of a disease, but who might be harboring some early precancerous or cancerous lesions which are not showing themselves outwardly at present. So basically we are doing the test in apparently healthy people. Now the well-established screening tests which we have now is, one is for cervical cancer, which we commonly know as the pap smear test, and then we have the breast cancer screening with mammograms. Screening for the other cancers, the techniques are not yet well established because the tests have some drawback or the other. Sometimes due to excessive testing, unnecessary procedures may be done. So the screening test should be something which does not lead to any unnecessary procedures. At the same time, it should be able to detect precancerous and early cancerous lesions. So the screening tests which we have now that are well established are cervical cancer screening and breast cancer screening.
Okay. So could you just tell us in detail about cervical cancer?
Yeah, cervical cancer is cancer of the cervix. So what is the cervix? It is the mouth of the uterus or the entrance of the womb. Cervical cancer, as I said, is very common in the developing countries. It is caused by a virus. That is a peculiar thing about cervical cancer. It's not like the other cancers in other parts of the body. It is caused by an infective organism, a virus. And the name of this virus is human papilloma virus, or the HPV virus. Now, how does this virus infect the cervix? It is transmitted sexually. So then we come to the risk factors. So if a woman is exposed at an early age to sexual contact, so from that time onwards, she will be at risk of getting a human papilloma virus infection. So early age of first sexual exposure is an important risk factor. And in the same way, having multiple sexual partners can also increase the transmission of this virus. So having multiple sexual partners is also a risk factor. Apart from this, when a woman has decreased immunity, For example, in conditions like HIV positive women, their immunity is low, so the virus can infect them easily. So they are also at high risk. Some ladies may be having decreased immunity because they are taking some drugs, maybe after renal transplant or some other transplant procedure. They may be taking drugs to suppress their immunity for medical reasons. They are also at increased risk of getting HPV infection and therefore cervical cancer. So what we do in the pap smear test is we examine the lady through a gynecological examination, and we see the cervix, and in this test we scrape the surface of the cervix, both the outer surface and the internal surface, so that the cells of the cervix are picked up through that smear, and then we send these cells for testing to see if there are any abnormal cells. If there is a long-standing HPV infection and if it has caused abnormal changes in the cells, then we can know by the pap smear test. If the pap smear test is abnormal, then we have to go to the next step of investigations depending upon whether the abnormality is mild or severe. If it is very mild, we can wait for 6 months to 1 year for the abnormal changes to resolve by itself. But if these changes are persistent or if the changes are very severe, then we have to do a test called colposcopy, where we can see the abnormalities in the cervix more clearly and take a biopsy from the most suspicious areas. Biopsy will tell us more in a more confirmed way about the degree of abnormality in the cervix. And again, according to the results of the biopsy, we will plan our treatment, which may involve something called cryocautery, wherein if the lesion is mild, then using a cryo probe, we destroy those abnormal cells. And in the same way, laser is available to destroy the abnormal cells. But if the abnormality is severe, then we use a wire loop through which electric current passes to shave off the abnormal area. This procedure is called LEAP procedure. And then more severe abnormality, we can take a cone-shaped piece out of the cervix, which will remove the entire abnormal area. Now, in some women who have completed their family and who don't want to have any more risk of cancer, they may even opt for removal of the uterus, that is hysterectomy. So these are the various treatments that we do when we see an abnormal pap smear and an abnormal colposcopy and biopsy.
So when should a woman start cervical cancer screening?
Yeah, like we discussed before, the age of first sexual exposure is important. So in many countries, the age at which they start screening varies. For example, in the States, they start at 21 years. In the UK, they start at 25 years. But the main thing is that within 3 years of the first sexual exposure, we have to start screening for cervical cancer. For the record, we can take it as starting from age 21. And if the pap smear is normal, then it is repeated at 3 yearly intervals up to the age of 50 years. After 50, if the pap smears are normal till then you can decrease the frequency to once every 5 years till the age of 65. And if at the age of 65 the pap smears are normal, then they don't have to have screening after that. So that is the frequency of pap smear screening.
So now coming into breast cancer, could you just explain to a layman what actually breast cancer is and what are the risk factors of breast cancer screening?
Breast cancer is a malignant tumor which occurs in the breast tissue. There are many different pathological types of breast cancer. The main risk factors for breast cancer, the first one is age. So age more than 55 years is a risk factor. Why I'm saying that this is the most common risk factor is that the incidence of breast cancer today is 12%, which means 1 in 8 women will develop breast cancer in their lifetime. which is not a small quantity. So any woman who is aged above 55 should keep in mind that she is at increased risk of breast cancer. So age is a risk. Then the other risk factor is, of course, if there is a strong family history, like if a mother or a sister has breast cancer, or even a daughter has breast cancer, then there is increased chances of developing breast cancer. This is because there is a gene called the BRCA gene. There are two BRCA genes, BRCA1 and BRCA2, which is transmitted from parents to offspring, which increases the risk of breast cancer. You may have heard of the famous case of Angelina Jolie, who has this gene, and she was at increased risk of breast cancer, and she lost her mother to breast cancer. And we all know that she underwent a surgery, that is bilateral removal of the breast. After completing her family, she went in for that surgery. So strong family history may be an indication that a person might be carrying these genetic defects, and which will put them at increased risk of breast cancer. Then the use of hormonal birth control pills, that has also been documented to increase the risk of breast cancer. We know that after menopause, hormone replacement therapy, that is given to ladies after menopause to treat the menopausal symptoms, that is also a cause for breast cancer. Then obesity and being overweight and having a fat-rich diet, that also predisposes to breast cancer. Alcohol and smoking, they are substances which reduce the body's immunity, and so they come under the risk factors for a variety of cancers, and in breast cancer also they can play a role. So these are some of the risk factors. There are some other risk factors which I may not have mentioned, but these are the main ones.
Okay. What are the methods of early detection for breast cancer?
Like beginning in their 20s and 30s, though it is an age where the risk of breast cancer is less, women can start doing the breast self-examination. That is, after their monthly period, they can feel their breast for any changes in the consistency or in the shape, or any pain, or whether they are feeling any lumps. These are things that they can look for by themselves. They can look also under the axilla, that is the armpits, for any swelling, and if any suspicious swelling or a new swelling, or the growth of a previously small swelling is noted, then they can consult their doctor and go in for more detailed tests.
Okay.
So that is one thing. For women who are 40 and above, what is recommended is a yearly clinical breast examination by the doctor. So these two are simple things that can be done. Coming to the screening test as such, we have all heard of mammogram. Now in different countries, the age at which screening with mammogram should start and the frequency with which it should be done, there is a big controversy. For example, there are two main colleges that we follow, the American College and the Royal College in Britain. So the American College says that the screening should start at 40 years of age and it should be done every year. Whereas the British College says that the screening should start at the age of 50 and should be done every 3 years. So there's a big difference between the two. So the message we can take from that is, if you start at 40 and do it every year, then there is more chance of finding more number of early cases or small cases which would go undetected if screening was started only at 50 years. But at the same time, mammogram is a procedure in which X-ray is used. So that itself causes some amount of radiation to the breast, which itself can be a cause for breast cancer. So the risk of radiation is one of the risks of mammogram, but compared to the risk of detection of breast cancer, it is not that much.
Okay.
So depending upon the risk factors for a particular woman, we can decide about the age at which we can start screening. For example, if a lady has already some risk factors, then we can start the screening for her maybe at 40. If a woman is completely low risk for breast cancer, then maybe we can start at 50. So we can decide according to the clinical situation.
How can we screen uterine cancer or detect it at early stage?
Yeah, when we say uterine cancer, we mean cancer of the inner lining of the uterus, which is called the endometrium. So when we say uterine cancer, we mean endometrial cancer, because there are some rarer types of cancer, like I mentioned before, cancer occurring in fibroid, which is also cancer occurring in the uterus. But commonly, uterine cancer means endometrial cancer. Unfortunately, there is no screening test available for uterine cancer, but the fortunate thing is that women who develop uterine cancer have symptoms at the early stage itself, because in uterine cancer the inner lining or the endometrium becomes very thick, and once it becomes very thick it starts bleeding. So many of these women present in the early stages with heavy vaginal bleeding. So a woman should be especially aware about these symptoms, or careful about these symptoms, if she has crossed her menopause and then she has bleeding, because then it is definitely abnormal. We don't expect bleeding after the menopause. So when a woman presents like that, we of course do a clinical gynecological examination. Then we do something called a transvaginal ultrasound scan, which will show us the inner lining of the uterus very clearly, and we can measure its thickness. We can look for any abnormal growth in the endometrium. So that is one of the investigations. And the next step in the investigation would be to take a biopsy from this inner lining, from the endometrium. This can be done in the doctor's clinic itself as an outpatient procedure, using a very small plastic instrument, which is really thin, so the patient will not have much pain. We take the biopsy and we send it for testing. Alternatively, we can also do a DMC, wherein the inner lining of the uterus is shaved off and then sent for testing. So that will confirm the degree of abnormality and whether the woman has uterine cancer or not. And I would also like to say something about the risk factors for uterine cancer. This cancer is also common after 50 years. Hence, as we said, menopausal women are more prone to this cancer. Then this cancer is more common in women who are obese or overweight, and many of these women will have associated diabetes, hypertension, hypercholesterolemia, so they will have many metabolic abnormalities. And also women who have been having irregular periods throughout their reproductive life, like women who have less than 5 periods in a year. So women like that, when there is a long gap without period, what happens is the inner lining of the uterus becomes thicker and thicker and thicker. So that predisposes to abnormal changes happening. This is especially seen in a condition called polycystic ovarian syndrome. So these women with polycystic ovarian syndrome have a higher risk of endometrial cancer than the women who don't have this problem. Then again we have the risk factors of not having children. Suppose a woman has not had any children, then also she is at increased risk. If a woman starts her periods at a very early age and she attains menopause at a very late age, so the number of years of menstruation are prolonged, so that also can increase the risk of uterine cancer. These are some of the risk factors.
What are the risk factors for ovarian cancer?
Yeah, risk factors for ovarian cancer, again, ovarian cancer is very uncommon before the age of 50, but it can occur even before that age, especially in women who have a family history of ovarian cancer or breast cancer. When we were discussing breast cancer, we discussed about the BRCA genes. So BRCA genes, as we said, predisposes a woman to have a higher risk of breast cancer, but it also puts her at a higher risk of ovarian cancer. So family history and carrying the faulty genes can also predispose to ovarian cancer, and not having any children, as in the case of uterine cancer, that can also predispose to ovarian cancer. Then if a woman has undergone treatment for pregnancy to happen, to conceive, by the use of fertility drugs and injections, that is also said to increase the risk of ovarian cancer. Then we said that in breast cancer, the hormonal birth control pills, they increase the risk of breast cancer. But in the case of ovarian cancer, they decrease the risk because they suppress ovulation. The birth control pills, the hormonal birth control pills suppress ovulation, and hence they decrease the damage which is done to the ovary by ovulation, and hence it actually is protective for ovarian cancer. And then of course smoking and alcohol intake, these are also some other risk factors for ovarian cancer.
What are the screening tests available for ovarian cancer?
Yeah, again, for ovarian cancer there is no effective screening technique. There are a few tests like transvaginal ultrasound and the measurement of a substance in the blood called CA-125, that is cancer antigen 125, which will be raised in cases of ovarian cancer. But the problem is that the CA-125 is raised in a wide variety of conditions, and also the transvaginal ultrasound, it may not pick up the early stages of ovarian cancer. So that is why some early cases may be missed by transvaginal ultrasound. On the other hand, CA-125 levels may be raised when there is no ovarian cancer, leading to unnecessary investigations or procedures. So that is why there is no effective screening method for ovarian cancer. Ovarian cancer is also called a silent killer. This is because in the early stages it produces almost no symptoms for the patient, and by the time the patient comes to the doctor with some symptoms, it may already be in a very advanced stage. So that is why this is an especially dangerous gynecological cancer, one of the most dangerous of all the gynecological cancers. But unfortunately it does not have a screening test. But for some women who have a strong family history, or who have already had breast cancer, or who are known to carry the defective genes, for them, even though it is not recommended or given as a guideline, we can monitor them with the CA-125 levels and the transvaginal ultrasound in selected women. But for healthy women, it is not recommended to screen for ovarian cancer using these tests. Only in a selected population of high risk women, we may have a role to use this two tests.
What about the rare types of cancers?
Yeah, now we discussed about the most common types. Apart from this, as I mentioned previously, we have the vaginal cancer, vulval cancer, the fallopian tube cancer, and the rare leiomyosarcoma, or the cancers occurring in the fibroids. Out of this, we said that the human papilloma virus is the one causing the cervical cancer. This same virus also causes the vaginal and the vulval cancer in a majority of the cases. So if a woman has abnormal pap smears, then it is an indication that we have to look for abnormal areas in the vagina and the vulva also. But the vaginal and the vulval tissues are more resistant to this infection by the human papilloma virus. That is why they are much rarer. The vaginal and vulval cancer are much rarer compared to the cervical cancer. So a lady with vaginal cancer may present with some bloody discharge or some foul smelling discharge or pain during sexual contact and symptoms like that. And some women who have undergone removal of the uterus because of an abnormal cervix, that is maybe precancerous changes in the cervix, they've already undergone a hysterectomy, those women have to continue screening with pap smear even though they don't have uterus, because they are more prone to abnormal changes in the vagina.
Okay.
And they are more prone to vaginal cancer. So for such women, the screening has to be continued with smears taken from the vagina. If you see vulval cancer, it is also caused in a majority of cases by human papilloma virus, but some other conditions called lichen sclerosis and some other conditions like that can also produce this vulval cancer. In the precancerous stage, the women may present with itching, burning, soreness, pain, swelling, discoloration. So these are all the things which should alert us, and when they come to the doctor, they will be examined, and if there are any suspicious lesions, biopsy can be taken to confirm the diagnosis and then treat accordingly. Fallopian tube cancer is really very rare. It is very similar in its behavior to ovarian cancer. In fact, they say that many of the ovarian cancers first start from the fallopian tube and then they spread to the ovary and present as ovarian cancers.
Okay.
So it has the same prognosis as ovarian cancer, which we said is a very dangerous cancer. So fallopian tube cancer is also very dangerous, and it can present with symptoms like pelvic pain or pelvic pressure, blood-stained vaginal discharge, and on examination there may be a palpable mass in the pelvis. So these are some of the symptoms with which fallopian tube cancer can present. So, but these cancers are very rare. Vulval cancer, vaginal cancer, fallopian tube cancers are rarer compared to the uterine cancer, ovarian cancer, breast cancer, and cancer of the cervix.
Okay. So, doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you.
So, that's it for today. Until we meet next time, this is me, Naina, signing off. Take care.